Fun health events held by the Memorial-Hermann hospital system is not a new thing, but rarely is the theme so delicious. Red wine and dark chocolate, and how they relate to heart disease.
Today, heart disease is rampant. It's growing exponentially. It is making lives difficult. I'm at the receiving end when heart disease gets really bad. But you should focus on heart disease at the beginning, when you're younger, when you're healthy. That's when you need to start thinking about what to eat, how to exercise properly, and when to see the doctor. Some of the signs and symptoms of heart disease including chest pain, shortness of breath, palpitations, dizziness. People such as those with diabetes, women, the elderly don't necessarily have the typical chest pain. They may have those other symptoms, and including some symptoms such as toothaches, jaw pain, or a feeling of uneasiness in their abdomen. I've had patients who have had just reflux symptoms, like they have an upset stomach and they were actually having a heart attack.
Approximately 34 Americans in the United States have a heart attack every minute. So basically what we do as physicians is try to educate the lay public on what to do when you have the signs and symptoms of a heart attack. So first of all, when you have the signs and symptoms of a heart attack like chest pain, shortness of breath, nausea, sweating, even lightheadedness sometimes, it's important to have an action plan together. And the time to put that action plan together is actually not when you're having the symptoms, but actually before that. So what we like to tell all of our patients is make sure that you have all of your emergency numbers next to your telephone with you all at the same time. Also be able to know where the hospitals are in your area, especially ones that have chest pain centers, because those chest pain centers are the ones that are accredited by a special organization that looks at quality for heart attack patients. So it's really important to know where those centers are. And here in the Southwest Houston area, there's two along the 59 corridor, and that would be Memorial-Hermann Sugar Land and Memorial-Hermann Southwest.
Fair enough, but what about the theme of this event? Red wine and dark chocolate?
Red wine and alcohol in general is not good for you in excess. But red wine specifically and chocolate, especially dark chocolate, have antioxidants and flavonoids which can help reduce the risk of heart disease when taken in moderation. They help reduce the inflammation in the heart and the rest of the body and help prevent heart attacks. It will lower blood pressure, it has a calming effect, and I think it is something that people should think about. But by themselves, they're not a crutch. They're not a easy one way to reduce your risk when you're smoking and eating horrible fatty foods the next day. And so I think it has to be a balanced approach. You have to have good diet, proper exercise, not smoke, properly control your risk factors such as diabetes and high blood pressure and high cholesterol, and then have a little bit of red wine and a little bit of dark chocolate. I think that's the key there.
In addition to a heart-healthy buffet and presentations by Doctors Basit and Clowney, attendees were also treated to a fashion show featuring Memorial-Hermann administration. It's always nice to hang around professionals, but it's even better when the professionals know how to have a good time. For more information on upcoming events, although not necessarily fashion tips, go online to memorialhermann.org. For Healthwise, this is Randall Williams.